Fall settles in, health officials are reminding the public that flu season is here. In the U.S., the flu can start to circulate this month and peak between December and February and extend through May. The best time to get vaccinated is before the flu begins spreading in the community. Flu vaccines are available through various healthcare providers, pharmacies, and walk-in clinics. I have two registered nurses with me, Vicki Hurdy and Lori Myers, to talk more about the flu season. Thanks, ladies, for coming in today.
Happy to be here.
Thanks for having us.
Yeah, so why is it so important to get the flu vaccine every year?
It's one of the major ways you can prevent the spread of the flu. So if you have a flu vaccine, just like we learned as COVID spread out, that more people who are vaccinated, the less it spreads. So the more people who are vaccinated with the flu, the less spread in the community. So it's important for your families, for your friends, for your coworkers. If you come to work sick, then you're spreading the flu throughout your workplace. So a vaccine certainly helps that.
Right.
Also, if you have respiratory issues, asthma, COPD, other respiratory illnesses, the flu is worse on your system than if you didn't. A healthy young adult, the flu's, not a big deal. It's not comfortable, but it's certainly not life-threatening, where it might be if you have other respiratory issues.
Now, what are some of the symptoms that happen with the flu?
So with the flu, what makes it worse than just the common cold is it lasts longer, and a common cold you can treat at home with just over-the-counter medications. With the flu, you're going to run more body aches, higher fevers, difficulty breathing, and those are all can be very serious, especially as we all age or have underlying health conditions.
Well, I know my mom, she's in her 70s, and she just got off a cruise, and guess what? She tested positive for COVID. And that's going around now too. Again, another reason to get the flu vaccine.
Right.
Having COVID and then the flu is double jeopardy.
And you can get a COVID vaccine and a flu vaccine on the same day at any local pharmacy. IU Arnett, Health Arnett has them at their pharmacy, as well as most other pharmacies in town. You can get them at your primary care office. A lot of the walk-in clinics do. Unfortunately, at the IU Urgent Care locally, we don't have the capacity to do that because we're caring for so many people with respiratory illnesses right now. We don't have the ability to do that at our locations.
So what's some other ways besides the flu vaccine to prevent the flu?
It's very important, good hand hygiene, washing our hands, using hand sanitizer, covering our cough and sneezes, staying home when you're sick, avoiding high public places if you're sick as well.
Maybe even wearing a mask. I mean,
can wear a mask if
we
you're sick.
still have those masks, a lot of them. So.
We learned so much during COVID to how to prevent the spread of COVID, and all of that applies to the flu as well. And in fact, the first year of COVID, we saw almost no flu because so many people were wearing masks and taking precautions. Hand sanitizer is everywhere. Yeah, absolutely.
Drying those hands out.
Absolutely.
Thanks, ladies, for coming in. You guys did a fabulous job.
Well, thanks for having us.